we have seen a lot of people in the last little bit that have experienced a lot of foot pain. That foot pain most of the time gets wrapped up into a condition called plantar fasciitis. There are some nuances with that, but here's what we want to show you today is how I evaluate and look at a foot and the different aspects that may entail. In approaching a new condition, of course, history is very important. The reported findings of when do you experience pain, is it in the morning, or is it sharp, is it certain pinpoint areas, is it the full foot, is it even part of the foot? That's super important to start narrowing down possibly where the main issue is. So we'll show a few things here on the table, and then we'll show a few things in a standing position, because you want to look at the foot as well when it is loaded, meaning body weight loaded, and the postures that the foot takes on. We'll go through that here in a minute. When I start with the foot, one of our first tests, of course, is palpation, the actual pressing into tissue on the bottom side of the foot and feeling for one, seeing if there is pain and asking the question, does that hurt? And I'm going up, in fact, I'll show you on this side, going up on that medial arch right through the bottom of the foot and looking at a few things. Of course, the posture of the foot itself, what it appears like. Is it pretty flat-footed? Is it already prone to being in a pronation position, meaning out or flat? Is there an arch? From there, I'm going to stress all that tissue up underneath by putting the foot into more of a loaded or flat position, and then passively extending the big toe especially back somewhere around 50 to 60 degrees, if that's possible for the person to see. Is that painful? At the same time, same test, holding into some tissue on the back part of the calcaneus, or close to the calcaneus here, and then extension. We are looking for reproduction of pain as a positive or negative test to tell us you're in the right area for plantar fasciitis. Our next test that we want to go over is called the Windlass Effect test. That is done in a loaded or standing posture. What we're going to do is we're going to take the toes, and this was a little bit awkward, but that's okay. You're going to grab the toes, and I'm passively extending those tissues, the toes themselves. That's pulling on all that plantar fascial tissue here. If it is painful, that is a positive test, okay? So that is another mark of us putting you into a category of, yeah, plantar fasciitis makes a lot of sense. But that's not our only other test. Let's go over the next one. So the next test that we're looking at is just how you stand. It shows us a lot of information in where you put stressors onto certain tissue. If your foot is extremely flat, you have what's called like a navicular drop, where the bone on the inside of the foot, or the arch, is collapsed in, and you have all this compression of tissue here and lengthening out of tissue here. So everything on the inside of the foot is rather flat. That, again, is called a navicular drop test or assessment. As well, when looking at a foot, we're looking at position of the posterior bone, which is called the calcaneus. Flip around for me real quick. What we're looking for here is, you can tell a lot of information when you look at the Achilles line or Achilles tendon. As well, if it is collapsed in, you'll have like this awkward bend, and you will see, okay, there's a lot of tension. Again, put on some tissue here, an unstable foot, basically. As well, turn back around. If a person is standing and they have a lot of eversion and that collapse in, eversion is where well, let me rephrase, two parts. Eversion of the calcaneus, again, is also seen with that navicular drop, as well as this abduction of the forefoot, where the foot is coming away from midline, right? So an external rotation or a flat foot shows us a lot of information. One simple test we need to make sure we add in is called like a pinch grip with the floor, like a paper pinch grip, or we can use a business card. Today we're going to give a shout out to our good friends at Utah Body Tempering. So this is going to go under the 4 toes, and I'm going to give it some tension. I'm trying to pull that card out, and she's doing everything she can to keep those toes down. She does an okay job, but it is a challenge for her. That is testing flexor digitorum brevis. We'll show a photo of that on the video as well, so you get an idea as to where that tissue, that muscle goes and where it connects from. It's a short one. It's not going to go past the ankle. It's not coming up onto the leg, okay? Same thing, opposite side. Again, not bad, not bad. Pretty good on that side in comparison, and there we go. For the sake of just being able to do this at the same time, we'll do big toe and see if that can actually grab the ground better, and she can do that with that toe. And here, pretty darn good. So not a weakness in the big toe, flexor hallucis longus muscles, anything like that, but a little bit of weakness in flexor digitorum brevis. Okay. Okay. All right, so within every assessment, especially with lower extremity, we want to make sure we're doing a gait analysis. At the beginning, she's doing a toe walk. We're looking to see, again, is there reproduction of pain or is it relieving? And that will tell us more information about her feet at that, and if she has the ability and control to get up onto her toes and stay there. Now she'll just do a normal gait pattern at the same time. And again, we are looking for discrepancies, any sort of drop foot, any sort of slapping or dragging of the toes, inability for her to lift the feet, that even like swing phase, and what happens at the big toe. All these are super important. Okay, so in conclusion, there are a few things we're going to utilize via orthopedic tests, functional tests, are all going to help put you into the category of, yes, you have plantar fasciitis or you have something else. If treatment doesn't help with plantar fasciitis over a 2 to 3 week period, there are times where you have to look up the chain. Then you're looking at the knees, we're looking at the hips, we're even looking at the low back. That is something that we have seen a few times where, especially if something is bilateral, meaning both feet, we want to pay attention to what's happening up at the low back as well. Thank you for watching. We're going to have other information coming out on the plantar fascia and plantar fasciitis rehab, and we look forward to showing you those. Take care.